early signs of pancreatic cancer might be abdominal and or back pain. We might see nausea, loss of appetite, indigestion, vomiting, weight loss that's unintentional in nature. We may see jaundice, that's yellowing of our skin or yellowing of the eyes, pancreatitis, some fatigue in general. There may be a change in our bowel habits. There may be new diabetes or diabetes that's not as controlled as it was previously. These symptoms can occur, they vary depending on where within the pancreas the tumour is located and also whether there's been impact on local surrounding structures as well. Symptoms of pancreatic cancer can appear late in part because of the location of the pancreas. It's located between our stomach and our spine, and there's many adjacent structures in our liver, duodenum and gallbladder. And so sometimes we don't see any symptoms until later where the function of the pancreas or those surrounding organs have been impacted in either function or from the pressure. Also, the symptoms of pancreatic cancer overlap with many other gastrointestinal conditions, so like reflux as an example, which is common, and so it can be difficult to discern between the symptoms of pancreatic cancer and something that's much more common.
If you're suspected of having pancreatic cancer, your doctor will generally do a CT scan or at least an ultrasound. If they find something abnormal in those, they will refer you to a specialist. It could be a surgeon or an oncologist. And at that point, you will require more investigations, generally more scans. So sometimes you need a dedicated pancreatic type CT scan. MRI scans are very helpful and used in some occasions. There will be other tests done, such as blood tests. And if there is a lesion that's picked up in any of these scans, then you will need a biopsy to confirm what it is. If you feel like that you've got some of the early warning signs, you should see the doctor and actually raise your concern, because the key message is that if pancreatic cancer can be picked up early, survival is great, cure rate is much higher, so early detection is always in favor of you. If I go to one particular symptom, if you look at jaundice, that's very abnormal. You should see medical help straight away the moment you notice that. But those other more subtle symptoms, such as losing weight or some new pain that you've developed, I would watch for a week, 10 days. If they still persist, I would go to the GP. I would seek help.